Welcome to Champions of Care, brought to you by Oakwood Healthcare. My name's Mary Zatina. Today we're talking about Parkinson's disease. 40 to 50, maybe even as high as 60,000 people every year will be diagnosed with Parkinson's disease. We'll learn about some of the signs, some of the causes, and some of the treatments on this episode of Champions of Care. With me in the studio is Dr. Mark Bustamante. Welcome, Dr. Bustamante.
Thank you, Mary.
You're a primary care physician. You have a couple of offices in Dearborn. You also lead the Oakwood Physician Network. Do I have that correct?
Physician Practices Group.
But today I want to talk about you as a primary care physician and this thing called Parkinson's. What exactly is Parkinson's, Dr. Bustamante?
Well, Parkinson's disease is a disorder of movement. People have difficulty with certain aspects of movement. Typically, tremor is a prominent feature, and slowness of movement, and stiffness as well is part of the disease.
How do you know it when you see it? You see patients over many years of their adult life. What are the symptoms? What are the signs? What's it look like?
Well, Parkinson's in the more advanced stages is very recognizable. The person is often stooped. They have slow, small steps. They have difficulty starting their movements. But early on, it's much more subtle. You may notice that the person's blink rate is slowed down. You may notice
blink rate with their eyes?
Blinking with their eyes. There's actually a slowness involved in that. The tremor of the hands is very characteristic. It is a tremor which is called a rest tremor, meaning that when people are not active, the hands shake in a rhythmic way. And those can be the clues that bring about the idea of Parkinson's.
And we have come to learn more about Parkinson's as a disease from Michael J. Fox. Now, he's a very young man, certainly high profile. Is this a disease of the young or typically older, or could it pop up at any time?
Well, it does occur in young people, but very uncommonly. Typically, we see it more often in older folks. About 1 people in 100 over the age of 60 will develop Parkinson's. And typically the onset of Parkinson's is closer to the age of 70.
So what's going on in the human body? What isn't working right when Parkinson's is the cause?
Well, there are certain circuits in the brain which are not fulfilling their role. So we have brain cells which directly activate our muscles. And then there are additional cells which coordinate those movements and smooth those movements. And that's the side of the brain that's not working properly in Parkinson's disease.
Are there aspects to the disease that are genetic?
There are. A few Parkinson's patients actually have an overt genetic syndrome, something that runs directly in the family. But for most, there are a number of genes, at last count about 16, I believe, which are involved in one way or another. And it's more the total influence of this gene pool which predisposes a person to Parkinson's disease.
And do your patients come to see you when they suspect they have Parkinson's? Or how is it that you uncover this issue?
Well, sometimes people do come in with that fear. Typically it's when a tremor is present, and fortunately most tremors are not Parkinson's disease, and so we're able to reassure people that actually it's not Parkinson's, which is good news. But we can also pick it up on certain clues. So just during an annual physical exam with a patient, there can be certain clues about the tone of the muscles, the ease with which muscles move, or the presence of a very subtle tremor. These things can be picked up during the physical, which suggests the possibility of Parkinson's disease.
Is there a definitive test?
There is not. Parkinson's disease is a clinical diagnosis, meaning that the doctor sees the patient and puts together the total story, their symptoms and their feelings and the physical exam. There are various tests which are included in the evaluation, but they do not prove or disprove Parkinson's disease.
So we've talked a lot about the effect and the presence of symptoms of Parkinson's disease. Are there conditions or situations that exacerbate those signs and symptoms, or the tremors or the shaking, as you call it, or do certain things make it worse?
Well, that's a good question. Certainly if someone is under stress or having anxiety, the tremor can become more prominent for a period of time. There are medications which can exacerbate Parkinson's symptoms, and of course the doctor has to be careful not to expose the person who's affected with those particular medications.
And as a primary care physician, how do you know it's time to refer one of your patients to a specialist?
Typically, the primary care physician is the first to suspect and identify Parkinson's, either because the patient came, as we said, or a clue is picked up. And very often, treatment is not needed for an extended period of time. And then when the symptoms become enough to be bothersome, there are very effective medications which are fairly easy to use, and often the primary care physician directs therapy. When those initial therapies begin to weaken, then it's time to turn to our colleagues and ask for help, both in neurology and in neurosurgery.
Well, we're going to turn to one of your colleagues to get a little bit more information on treatment options in a few minutes. But I want to thank you so much for being with us today and giving us that overview of Parkinson's and how it looks from the primary care physician's perspective. Thanks so much for being here.
Thanks for having me, Mary.
Dr. Mark Bustamante is an internal medicine physician with a practice in Dearborn, Michigan. You can find out more about him on oakwood.org. We're going to take a short break and then come back and talk with a specialist about treatment options and support groups for those with Parkinson's disease. Stay with us.
Hungry?
Yeah.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today.
Want to quit smoking for good? Oakwood can help. Call our free Quit Smoking resource line to help you kick the habit. Whether you're interested in medications, online programs, group classes, coaching by telephone, or hypnotherapy, our health education specialist will be able to direct you to the Stop Smoking resource that best meets your needs. Start your journey to better health by calling Oakwood's Quit Smoking resource line, 313-586-4938, or visit oakwood.org for more information.